to look and see what kind of shoes you had on. Stepped off the curb, rolled his ankle. Okay. Now, based on his shoes, it's going to be a pretty high injury. Just depending on how tight they are, it depends on how he falls, that could just snap the leg a little bit. If it's standard low-cut tennis shoes, flip-flops, and stilettos are notorious. All you have to do is slip and roll your foot, and you sprain your ankle or fracture your ankle. Alright? You could, but I won't be able to tell in that situation, so I'm going to treat it at least like an ankle fracture. And probably splint it the same way. I haven't seen a fibula fracture where it came through the bone. And just based on the location, then you guess that that's what it was. I didn't have to do anything because I was already in the hospital and emergency room as a patient with anaphylaxis, and they wheeled this guy into the bed next to me. So I got to see all the films, and we got to watch what they did and stuff for him. So it's just remembering that kind of stuff. Since you tried to avoid and divert your eyes, why don't you come out here and help? Grab a blanket on your leg.
Yeah, she was recording that. She was totally recording that.
Come right down here.
What did he do? I wasn't paying
She was
attention.
totally recording that.
You're not going to be able to see anything but his backside. So
Oh.
you're doing a video, you're going to have to come over here or sit there. Okay. When you're looking, especially like with the elbow and humerus, when you're looking at lower extremity fractures, you're looking at a situation where you need to get your ties in place first. And in this case, we need 2 triangular bandages to start with. So I bet you can get somebody to hand you another one. Ultimately, we're going to need 3, and I'll take the 3rd one.
Appropriate.
Okay. Fold those up so they're nice and wide like this. Look, that's already folded, okay? Generally, when you fold them so that pointy tail end's not dangling loose, but that's okay. You fold it in half and fold it in half again. Or fold it in thirds. There you go.
Just say I did it right.
Okay. All right. You need to be on your knees. You're going to take that and don't lift your leg up. 1, how's he going to check CMS with the shoes on? I think it's an ankle sprain or an ankle fracture. Do I take the shoes off?
No.
No. Okay. Can't really check. Iffy.
Have them wiggle their toes.
Okay. Squeeze his toes firmly and ask him if he can feel it. Okay. Now don't really let go. Hang on to it gently and very gently tighten your toes. Did you feel that? So I don't need him to wiggle his foot. I just need to hold on to the shoe and have him tighten his toes so I can feel that contraction, and I know that he's got motion. Okay? Yeah, we'll be nice and make it a better worst case scenario. Take that, come up at the knee, and you're going to slide the end of that under the knee, and then slide it down. Go ahead and slide it under. Don't lift your leg. A real patient generally won't offer to help. Now, stop. Come back up fairly close to it, and keep tension on it. There you go. Slide it down. Keep going. Keep going. That's good. Just lay it down. Well, he kind of wadded it up so it's a nice tight little band now instead of keeping it nice and wide, so I might flare it back out and raise it just slightly right there. Now I'll take this one and slide it so it's sitting just about at this level behind his leg. So you're going to have it draped up over his other leg. I'm going to take the 3rd triangular, and I'm actually going to make it a little bit wider. I'm going to fold it a 1/3 of the way over, and a third of the way over to make it a little wider. And I want you to lay that flat on the ground, just like this, right up against the edge of his shoe. You're gonna have to move your knees just a little bit. No, lay it flat on the
I got
ground.
you.
Try not to kick them and move their leg like that. Okay. Now, come back up and very gently put your knees just on either side of his foot and support his foot a little bit. So-
On top of this?
No, yeah, put
Scoot
your knees
forward.
on top of it,
Gotcha.
very gently. Ultimately, he's gonna be like this to support it, okay? Go ahead and back away for a second. I could use a couple of board splints, it's difficult, it's a pain. I could use a SAM splint, or I could grab 2 pillows, which is what they do on the ambulance all the time, or I could take a blanket, and look, the blanket's already nicely folded. See how it makes a U? Put it right like that, around the bottom of his foot. Bring it up gently on either side. Okay, now bring your knees forward and support that. Gently. Okay, start distal, go proximal. Take the one that's near the ankle. Bring it up. Try not to catch this end in it. Tie it securely. 1 or 2 loops here doesn't make a lot of difference because we have a wool blanket. Pull it snug, don't jerk. Okay, come back in right next to the knot and kind of get one hand up and one hand down like this so you can really get some tension. And let's see how much more snug you got it. Tie the rest of your knot. That's how not to tie the second half of the knot. Okay, tie the next one, but make sure you're below his knee.
You want that one below the knee, you said?
Yeah, I want it below the knee. We're not actually gonna try and stabilize the knee generally when we do an ankle. We're just stabilizing the tib fib a little bit, partway up the leg. Okay, now back away a little bit gently. Now see how you kind of slid it away. I'm gonna slide this back up. See how that's caught, it's right at the edge of the shoe and it's caught the edge of the blanket? So take a hold of it and kind of wrap it up at an angle to where you can come right here, right here. Okay, bring your knees back in. A little bit right there. Okay, tie the first half of your knot. Nice and secure. Now, this is where the textbook stops. This is where all the first aid pictures stop. And the patient can still have a little plantar dorsiflexion here. So just a little extra oomph to it is bring it back and tie it right here on the sole of his foot, on the ball of his foot more or less. You're probably at about the arch, which is fine. Now you gotta be real careful because you'll move it a lot. Tie the rest of your knot. That just gives it a little more added security than what you'll see with, standard, just tie it at the angle. Okay, squeeze his toes. Ask him.
Can you feel this? Can you pull your toes back?
Now, always, I preface it with gently tighten your toes or gently pull your toes back. Because otherwise, they'll try and dorsiflex their foot instead. He tucks in the loose ends. We get 2 of the guys out here, no offense, 2 of the guys out here, we pick him up and we move him.